Hi, my name is Takumi Azuma. My English team is How to Stop Snoring for Peaceful Nights in Shared Room. First is introduction. Why I choose the theme of snoring. I went to Okinawa with my university friends. I stayed hotel in 2 days. So friends complain about my snorings. I'm so surprised. Snoring is not rare problems. About 47% of Japanese people have some kind of allergy. Allergy often causes a stuffy nose and makes breathing difficult. Cedar, cats, dust, mite, temperature changes is very major allergies. Unfortunately, I have all allergies. And about 80% of Japanese people have a divided nasal spectrums. Normal people is a nasal structure is very straight compared with the divided spectrum. This structure is curved, so it is hard to breathe in. Okay, how snoring happens? First, nasal breathing blocked. Second, mouth transfer mouth breathing. Third, tongue falls back. So airway is narrow and blocked airway is caused snorings. Purpose of this study: to find the most effective way to reduce my snorings. Stop is very difficult, so I concentrate to reduce. Okay, next is outline. Experiment contents, methods, results, considerations, conclusions, references. Okay, first is experiment contents. Prior studies, pillow height affects snoring frequency. Higher or lower pillow changes snoring count. And other studies, sleeping position matters. Spine, and lateral positions is decrease the apnea index. This apnea is the number of the snoring count. And the transition to my study is very individual researches, so I will test both together. Okay, second is method. How it's measured? I use Pokemon sleep. Pokemon sleep is measured the sleeping levels in 3 sections: dazing, snoozing, slumbering. It's very difficult, so it is images, sleeping deepness indicators. So other facilities have record top 10 loudest sound each night. So I record the snoring, I count it. Okay, participant, a researcher myself only. And I have allergy and divided nasal spectrums. And 4 hours rest is I exclude because it is unstable. And one condition, I conducted 1 week. Okay, what are you comparing? Pillow height comparison of pillows stacked 5, 10, 15, 30 centimeters. Unfortunately, I don't have 30 centimeters pillows, so I'm stuck in. And different in postures, spine and lateral. Okay, next is the result. Pillow 1, pillow 2, pillow 3, pillow 4. 4 was conducted. I summarized the 4 weeks. Best results is 10 centimeters. And too high or too low is more snorings. And less snorings is more deep sleeps. So in this result is very matched in my intuition. Okay, next result. pillow height adjusting 10 centimeters because it most reduce the snoring count. And posture is spine and lateral. Spine one weeks and lateral. Okay, I summarized. Lateral positions affect for reducing snorings. And spine is better for sleep quality. I'm so surprised because it's not matched in my intuitions. For considerations. First, pillow height 10 centimeter is lowest snorings and deep sleeps. I think less snorings, easier nasal breathing, and better oxygen supply. So, deep sleeps. And posture therapies. Later, fewer snores, and spine, more deep sleeps. Maybe I think habitual spine sleeping may explain this. I'm 20 years, I do spine postures. Okay, sleeping dynamics next. Beginning of sleep, I do lateral. It goes fewer snores. But later in sleep, in midnight or morning, later to spine, so it goes more sleeps, more snores. So return to habitual spine. Okay, next is conclusion. Adjusting pillow height and sleeping posture is very important reducing snoring. Is references? Thank you for listening.